When I was reading, we were talking about companies with 50 employees or more are going to, by 2014, have to pay a certain amount of money to the government, I am assuming via tax, for every employee that they don't cover. Now, there was an interesting case study that I read, and I wanted to ask you your opinion on this. A gentleman somewhere in Pennsylvania was stating that he has 120 employees, that the government was going to charge him $750 per employee if he didn't cover them. To which he responded, great, except the $90,000 that I would give the government every year is a fraction of what I actually pay in health care benefits for my employees. He pays $480,000 a year to cover 120 employees. So the government, by virtue of creating this particular package, is actually de-incentivizing, if that's a word, I think I might have just made it up, this person to actually create health care. Did you want to ask a question on top of what I'm saying? Can you stand up?
Lori Rodenger's Financial. I just wanted to respond to that who's going to go, if there are two employers, one offers health insurance, one doesn't, who are the talented people going to go to? And I think that's the, maybe it's a $450,000 investment into getting good employees rather than saving, paying $750 and not getting the cream of the crop. So I think that has to be part of the discussion.
That's absolutely an interesting point.
Right.
Do one of you guys want to speak to this whole
from
idea?
From a financial standpoint, what you're raising though is the soft mandate. I mean, that's really the concern, is around this insurance pool coverage thing. One will hope that employers will still offer it for the talent, other issues, but that'll be an issue because of just what you cite, which is the finances won't necessarily work.
But it's more than that, and I know you guys have to tell me this because, okay, so let's say for the sake of argument, we have an employer that says, look, if I don't have to pay $480,000 a year, here's my 90 grand, have at it. I don't want to have to deal with this. I'm happy to save the money. I'll give it to benefit my people elsewhere, or give them more money in their salaries or whatever to compensate. Now I'm one of those 120 employees and I have to go to, and I need you guys to explain please what this is. What is an insurance exchange, and is it going to be ew? I mean, is it going to be the type of thing where I walk in and I'm going to be like clawing at my own skin because it's government run and everybody's wearing gray and it's icky and, what are we talking about here? Because that scared me to read that. Can somebody please tell me what these things are?
If I could start with that one,
Yeah.
There are going to be state-run exchanges beginning in 2014, and there are going to be the metal plans available. There'll be bronze, silver, gold, and platinum, and they'll be priced accordingly, and you'll be benefited accordingly based on what level you buy. But these will be plans through insurance companies. You won't go to the village that you live in to the witch doctor for care. You'll have insurance, and you'll continue to have private practice physicians, hospitals that you can choose. So that's
So if I go
in
to
a nutshell.
if I go to the exchange, do I have a choice as to which insurance company I go to?
That's, the exchanges have to decide that. So
clearing
the state governments will have to decide
Right.
who will be offered.
So like you're Kaiser, so you might or might not be in my exchange?
One will hope we will be.
Okay, good to know. Go ahead, Bill.
I was thinking about the $90,000 a year question too, is that doesn't include what he's got to pay somebody to take care of all that stuff. So it's probably saves more than $90,000.
That's true.
That's me, and I work very cheaply.
10. I was doing enough reading to be dangerous last night. I had a couple questions maybe for Bob. How does the new Medicare tax work and who'll have to pay it? And I guess as a follow-up, how does the Health Care Act cost businesses money?
You're right. The close to 50% of this act is expected to be financed by these extra taxes, such as the Medicare tax. So basically, during Mr. Obama's campaign, and since we've heard a lot of talk about high-income people, which are defined as joint tax filers of $250,000 wages. In the case of a single individual, single wage earner, $200,000. What this does in 2013 is when this part of the law kicks in. Those wage earners will pay an additional 0.9%, a little under 1%, on all their wage income that is in excess of $200,000 or $250,000 for joint filers. That's a huge number, huge addition to Treasury. The other place where many people will get hit, particularly retired folks, so we've heard a lot from those interest groups recently, is what's called net investment income. Interest, bank account interest, dividends, i.e. stocks or mutual funds, and capital gains, sale of stocks, sale of bonds, 3.8% tax that didn't exist before, also kick in 2013. So that's a huge, huge amount of revenue. Both of those taxes can apply to some people, and during the 9 or 10 year period that the projections have been done, we're looking at over $200 billion coming into Treasury from just these areas. And just the other side of your question, Bill, how will businesses be financially hurt, if you will? One of these gentlemen here mentioned that makers of medical devices, which is a pretty expansive definition, will pay a new tax called new tax 2.9%, added on to whatever tax they're already paying. And indemnity companies will be hit based on their productivity, expected to be $60 billion of additional tax coming in from the indemnity companies, from Care First and some of the United, and the largest providers, Kaiser. So I hope that answers your question. Those are the things that definitely are coming out of both individual and small business and big business pockets to fund this.
And that $60 billion that's going to be allocated in an as yet to determine manner to the insurance companies is a non-deductible item. What the intent is to have it just come out of the net profits of insurance companies. The reality is it's going to come out of the pockets of the premium payer, because something will get adjusted in the premium side to pay for that, which is an impact on the payer of the premium.